Hi, everyone. Thank you for joining me today here at Oasis Women's Functional Medicine. You are in for a treat today. Have you ever wondered the connection between your oral health and your health as a woman through perimenopause and menopause? So, this episode, I am here with Dr. Gupta, who is a world renowned holistic dentist. And I'm so excited that she's here today. So please go ahead and introduce yourself, Dr. Gupta, to the audience.
Hi, everybody. That was a very generous introduction. I may not be world renowned, but the love for biological holistic dentistry is so real that. So, a little bit about me. I am practicing in Rochester, New York area. I have two locations here, and I am a biological holistic dentist who is practicing with the philosophy that your mouth is connected to your body, and anything that happens to the mouth or anything that happens to the body is connected with each other. So that's not two different silos that we can separate out from each other. And this philosophy has helped us tremendously in understanding a lot of the physical conditions that our patients often struggle with. And some of them are either rooted in the mouth, or some of the other conditions are also affecting the mouth. So I truly enjoy this kind of deeper knowledge. And what I am constantly seeking is the root cause of stuff. So that's a little bit about me.
That is amazing. Thank you. So when we first met, there was something you said that really um, made an impact on me, even as a functional medicine doctor. And it was that you had done some saliva testing on a patient, and you sent them to the ER because of that saliva testing. And it turned out that they had colon cancer or some sort of GI malignancy. And so I was so impressed. I was like, wow, who knew that, the bacteria in our mouth could actually show to this extent of what's going on. And
Correct.
so I would like to know what made you decide as like a general dentist to go towards the holistic. Can you walk us through that journey for the audience to know you?
Oh, absolutely. So, as a general dentist, that I practiced as a traditional general dentist with a very standard training, wherein we learn about fluoride, we learn about all the different mercuries that are a part of the training process. Something constantly lingered in my head as not connecting the dots. Why am I still seeing so many different things happen if fluoride is so good for us? If mercury is so good for us, why is this happening? And a lot of the times, the big questions were that why are the patients still coming back with the same problems constantly? And and I don't have one specific timeline to tell you what changed me dentally, but what did change me a lot is my own personal story, in which I had a few health issues which I felt needed a deeper, uh, more root cause analysis, which I found that my medical community didn't support me with those answers. So that's where I started thinking, what if there is more to the mouth than we are looking at?
Mm.
And what if the mouth needs to be looked at from a different lens? And that's why I think I started looking more broadly. When I first got introduced to saliva testing, it just opened my world up. I'm just taking a small little sample of a patient sitting in my chair, putting it in the on a slide in a microscope, and I suddenly see it just buzzing with spirochetes, those disease-causing bacteria that's present in our mouth. And the same patient, when we send the patient for a lab saliva test, is coming back with elevated number of microbiome of all the different types that are associated with, say, colon cancer and other conditions. Lo and behold, the patient had a diagnosis of colon cancer also. So those little things that when I was inching forward kept validating my belief system that I need to look deeper. So
Yeah, I mean, look, I mean, can you imagine, that poor patient would have waited and waited and they would have finally found colon cancer, but God knows maybe it would have been advanced, And so
correct.
when you think about going to the dentist, you are thinking, I want my smile to look pretty, I want my
Mm-hmm.
teeth to look white, but there is so much more to
Mm-hmm.
your mouth than just like white pearly teeth. We all want that, but we want the deeper things too.
Correct.
So yeah, thank you for sharing that. Before we go any further, I have some statements here that I
Okay.
collected that I've always wondered about. And I want your opinion, whether it's truth or fact, and then we can go back and do a deep dive into each of them.
Okay.
So, first statement, if you have no tooth pain, your oral health is fine.
That's the biggest myth. And I want to add a line to this. I often tell the patient the symptoms are the last to show, especially with teeth. So that's why absolutely wrong. False.
Okay. So, for those of you waiting for or tooth pain before you see your dentist, you heard her. Next statement: hormonal changes can alter the oral microbiome. Is that truth or fact?
Oh, very much so.
Oh,
There is
fact or myth? Sorry.
it is a fact, very much a fact that it will be affected, and because as a women's health specialist, you know this, that there is not just the three hormones, estrogen, progesterone, and testosterone. There are so many others. For example, cortisol, a stress hormone that is going to truthfully cause chaos in the mouth if it's allowed to run wild. So yes, that is a fact.
Abs- Absolutely. And you can have advanced gum disease without obvious symptoms. Is that fact
Very
or
much
myth?
so. Very much so. Yes.
Okay. Women on hormone replacement therapy actually have better gum health than those who aren't.
I mean, I would
I know it's
say it's a it's a deeper question. So the simplistic answer can be, if I am only allowed yes or no, yes. But of course, there are other factors that will play a role. But broadly speaking, yes.
okay. Gum disease can worsen blood sugar control.
100% of the times, because I can tell a patient almost accurately if a patient has elevated blood glucose numbers based on their gum condition. So even
Wow.
before their physicians figure out whether the patient has diabetes, I can look at their gums and say, if you don't have diabetes, you're about to get it. So
Wow. Wow. Then next statement: dental health has very little to do with hormones.
that is not true at all. That is
Okay.
a total myth, because a simple example is we explored this very deeply, uh, that estrogen itself can cause enough changes for a woman to have problems even dentally. So simply speaking, just reduced saliva flow, changes in all of the secretions can lead to issues in the mouth. So that's just scratching the surface, but there are so many deeper associations to estrogen changes.
Absolutely. And I'm going to go back to that topic
Mm-hmm.
particularly, so we can talk more about hormones and oral health during
Right.
menopause. The next statement: bad breath is mainly a stomach issue, not a mouth issue. Bad breath.
Uh, it's a great question. I think it's bidirectional, because the gut truly contributes to halitosis, the bad breath, but even uh, poor oral health could be a player, but oftentimes we'll see patients with great oral health, but very poor gut health, still having bad breath. So yes, they both have an impact on each other.
Nice. Vitamin D deficiency has no significant effect on your gum health or tooth loss risk. Vitamin D deficiency.
Actually, that's a very much of a myth. Vitamin D is so important that now when I am extracting teeth or placing implants, I am absolutely requiring for my patients to have their vitamin D levels checked by their primary cares or their functional medicine doctors, because as a functional medicine doctor, you can attest to this, that the way you want that optimized vitamin D level is a little bit different from my other colleagues, because we need that higher level of vitamin D to support the healing functions and all the osseointegrations that we need. So yes, vitamin D is extremely important. And I would say so is vitamin C. So we really want our patients to be optimized for those two.
Is there, while we divert a bit, is there a certain level that you look for vitamin D before you do any sort of oral extractions? And
Actually, I try not to get held up by a number, because oftentimes it's the right number is different for everybody. So I let that the decision come from the functional medicine doctor most of the times, because they understand what is optimized. So
yeah,
nothing over the top, but a nice optimized patient is always better.
absolutely. I think most functional medicine, and I'm not speaking for everyone, but most of
Mm-hmm.
us like 60 to 80. That's
Correct.
like the number that
Yes.
we like to, we find is optimized for different things. Okay. So mouth breathing can
Mm-hmm.
change facial structure and oral health over time. So mouth breathing.
Absolutely, that's a fact. And if you allow me a minute to talk about this, mouth
Yeah,
breathing
please.
um, is one big factor that changes the entire ecosystem of the mouth. So it starts with changing the microbiome of the mouth. It causes more dryness in the mouth. It causes more cavities to happen in the mouth. It changes the tongue posture. When the patients are breathing from the mouth, they may have longer faces. They are not able to close the mouth for whatever reason. Some people are doing it only in their sleep. So it's fairly detrimental. I explain to my patients that cavities are a culmination of, say, oral hygiene, nutrition, type, frequency, how much of sugar attack, meaning the pH is going up and down, and very, very importantly, mouth breathing. So if I have to categorize them, I often say mouth breathing is way up here, and then all of these follow along. I'm not saying that brushing and flossing don't have an important value. I'm just saying this whole thing is a product of a lot of these factors, because we keep blaming the patient, oh, you're not brushing, you're not flossing. The truth is, there is so much more happening that could lead to problems.
Yeah, thank you. So would you encourage mouth taping at night? Like, what is that something you encourage your patients to do
So,
if they think they are mouth breathers? Or
so the simple answer is, without having ruled out why they are mouth breathing, telling somebody to mouth tape could be dangerous, because if that is the only way they can breathe. So I would never do that. Oftentimes, if there is an adenoid issue, or if there is a nasal septum deviation issue, or sometimes we'll see mouth breathing because of, like, say, allergies. This is the season for it. People are doing it. So those are different reasons. And I often find it like, even if I'm telling a parent to do mouth taping for a child, I want them to monitor the child really closely to make sure that the child is still able to comfortably breathe. Do I like the idea of mouth taping? Absolutely. It helps in in creating a seal, keeping the mouth moist, increasing oxygenation, and it is helping in the proper musculature and the posture of the tongue the way it should be. But it's for not for everybody. So we need to go into the deep dive. Why are you mouth breathing?
Absolutely. Absolutely. That makes a lot of sense. So, women who are postmenopausal are at no greater risk of tooth loss than younger women if they brush and floss daily.
I love that question. The real answer is no. It's not true, because when people are of that age, when women are losing bone in the rest of their body, how will the jaw bones be spared of that, right? So, does good oral hygiene help in keeping them in a better place? Yes, absolutely. But if the hormone levels are not optimized, or if they are dropping and they are causing more bone issues, they may also show up in the mouth, leading to tooth loss associated to bone.
That makes, yeah, that definitely makes a lot of sense because if you are have become estrogen deficient because of menopause, then
Mm-hmm.
brushing and flossing every day will not slow down bone loss because the root cause there
Correct.
is that
Correct.
you don't have estrogen anymore. Okay.
Correct.
Mouthwash always improves oral health. Mouthwash.
I absolutely love this question. Mouthwash is destroys. I mean, it has to be so carefully spoken about this conversation, because the typical mouthwash that people pick up from the grocery store when they go for like a run to the bed, some of those mouthwashes are just destroying all of the microbiome in the mouth. I'll give an
Mm,
example. One of the examples is there is a type of microbiome that is needed to release nitric oxide. And nitric oxide, as we know, is required for a lot of bodily functions, especially reducing blood pressure. When people are
yes.
using the random chemically loaded mouthwash, they are destroying all of that bacteria in their mouth, which is therefore leading to other problems. One of the other people who this particular bacteria is missing in is people who are mouth breathing. So that's why I have conversations with my patients based off of mouthwashes. Do I talk about using mouthwashes? Yes, I do, but with caution. I have to make sure that my patients are using stuff that is not loaded in chemicals, that is more like probiotic or probiotic that is very microbiome and only being targeted towards the bad microbiome. So very natural stuff which will allow for good microbiome to thrive.
Yeah, thank you so much. So, um, when you were speaking, there was some break in the internet. So I just want to recap the main thing that I heard was that with certain over-the-counter mouthwash that we have, it may have some chemicals that really go after the oral microbiome or particular bacteria that produces nitric
Mm-hmm.
oxide. And nitric oxide
Correct.
is needed in terms of vasodilation and blood vessel
Mm-hmm.
and blood pressure amongst other
Correct.
functions. And so when someone is picking up a mouthwash, it matters what ingredients are in the mouthwash. And a natural
Mm-hmm.
version of a mouthwash is actually a better option. Um,
Correct.
so my follow-up question is there a particular ingredient that we are to look out for to make sure, is it alcohol in the mouthwash or is it something else that we have in typical mouthwashes?
I mean, alcohol is one of the number one things. But for example, the big blue bottle, for example, Listerine, has a lot of other chemicals that have been loaded into it. that are causing this generalized destruction of the microbiome. So that's why the inclination is to do something extremely natural. What I incline on telling my patients to do is more of oil pulling. I like the idea of oil pulling way more than I like the idea of a mouthwash. So, like a nice nightly regimen of doing oil pulling, like brush, floss, do some oil pulling. That's what my regimen would be rather than just a mouthwash.
Oh, okay. So, for those who don't know what mouth oil pulling is, can you give us like a an idea of how you
Yeah,
would do that?
sure. Oil pulling is basically like there could be special formulations of oils now that are being sold like through big box stores or on Amazon. These are just simple liquefied oils that may be mixed with a herb. Sometimes they're mixed with ozone, and you can take a small amount in your mouth and swish it all around for as possibly 5 to 6 minutes if you can. I promise you it gets tough because your muscles hurt by doing the swishing around. But if you can get it in for at least a minute or two every night, it would be great for keeping the mouth moistened and keeping the microactivity lower through the nighttime.
Yeah, thank you. I mean,
Mhm.
I heard of people using just coconut oil from the kitchen,
Yeah,
but I guess I will check out the ones already formulated on Amazon. I'm sure it's
it's just
easier to do than
sometimes
coconut oil.
sometimes the coconut oil in the way, like, we live in Rochester, New York, and it'll always be slightly thicker, so it's more hard to get it going. So that's why it's easier to squirt something in.
Gotcha. Okay. Um, Last question. Chronic dental inflammation can affect energy levels.
Well, absolutely, they can affect the energy levels because, like, I'll give you an example. May not be directly talking of energy per se, but any infection in your mouth is driving from your immunity and from other sources. So that is why, if it's chronically present, people with suffering from without knowing. For example, I'll have patients who will come to see me for they don't even know that they have an infection. Let's say it's an infected tooth without pain. Like I said, symptoms are the last to show. And they are telling me that I have chronic back pain or I have had low energy and things like that. So those are the patients that have been holding something chronically in their mouth, and now it's manifesting in different forms, but it hasn't yet showed up in the mouth.
I see. Wow. That is some great connections. I hope those of you listening so far, you've gleaned a lot of knowledge from Dr. Gupta with this statements. Thank you for providing some background and explanations to your answers. So I want us to do a dive a bit into menopause because that's where my focus is.
Mm-hmm.
And I tell my patients all the time that once you start losing estrogen, things dry up, including your
Mm-hmm.
oral cavity. So
Mm-hmm.
share with us like what you see on your chair when someone is in menopause. What are some of the things even before they are told that this could be menopause, they are in menopause, can you share some of the things that you start to see?
Yeah, absolutely. So, one of the most profound things we start hearing, actually, I should go back a little bit. I may not even hear it, but I ask a lot of times is, how's your sleep? And patients will say,
Mm,
oh, I have not slept in so many months, years, whatever. And then when you start tracing it back, the reason I'm asking about sleep as a dentist is because I see some signs in the mouth that are giving me a very, very good understanding of what this patient possibly has some sleep associated problems. Where I'm going with this is I'm seeing signs of clenching, attrition,
Mm.
lots of traumatic wear on the teeth. I see the size of the tongue, and I would see big, scallops on the tongue, which is the indentation of the teeth. I would see the patient has a lot of restorative work, which is constantly falling apart. And a work that was done a few years back, now it's being redone. We were, we had to come from a mindset of constantly blaming either the patient or the dentistry, not realizing that there is this middle cause that could be causing good dentistry in a good oral hygiene to fail because of whatever else is happening. So the number one reason why dentistry fails is because of overloading of the teeth that happens during sleep. Why I'm saying menopause or perimenopause is the time, because things are changing in the body, and let's say somebody already has a small mouth wherein the tongue doesn't have enough room, it gets thrown into the throat. The patients are either mouth breathing, or they are holding the jaw really tight and clenching and grinding and all of those things. I start seeing those things as being manifested in the mouth. So besides that, we will see changes in the neck muscles, in which the fascia becomes loose, and then we will start seeing changes to the floor of the mouth, and therefore more likelihood of patient snoring or things like that. So when I connect these, all of these are connected. It's not just menopause women will have it, but even men would have it. But then I'm just trying to give you more relevant examples of what all I see. I would see women's mouth getting so dried out sometimes,
Mm.
that despite the best practices of hygiene, despite the best dental work done, things are falling apart simply because of extreme dryness in the mouth. I would see more uh, gradual bone loss happening in patients when menopause has happened, because if let's say, I'm going to say this broadly because I know not everybody is a candidate for hormone replacement, and not everybody gets hormone replacement, but I do see this sometimes wherein the hormones are not optimized. I will see more deterioration of the bone in somewhat of a speedy manner. But there
Mm.
are so many other factors to it. Sometimes it's the small mouth, collapse, bite, already existing factors that just compound the problem faster. So, very in a nutshell, I do see some issues as a woman in menopause myself, because I have optimized a lot of things with my own health. I know, I often call it, I'm bracing for impact, and I'm trying to prepare my body for that winter, like the Game of Thrones. I'm preparing my body for the winter. So, and that's how I like to educate or share information with my patients.
That is, thank you so much. You make the mouth a very fascinating place. I just listen. I could listen to you all day about the fascination of the mouth, and what, there are all these things that we just don't even think about when it comes to
Correct.
oral health. And I love that you go and you go beyond just like the structure, and you are looking at physiology, you are looking at the
Uh-huh.
microbiome, you are looking at the gut health, and just trying to piece it all together in this one cavity. It's pretty amazing. I love it. I really love it.
Thank you.
Um, yeah. I want you to tell us about your work with people struggling with sleep apnea, because you
Hmm.
touched on it with the mouth getting smaller,
Correct.
and all those things. And a lot of people hate the CPAP. As a doctor, I would tell you they don't want to hear it
Hmm.
about wearing a CPAP. And then I also don't know a lot about the mouth guard, or those things, that
Correct.
and there's the, also the stimulator that someone will have to go and have it implanted to push the
Mhm.
tongue forward. It just seems like a lot. So
Correct.
tell us, I know you do some work for that population. So tell us about that.
So the truth is, Ruth, this is a very it's a very topic very close to my heart, and I'll
Yeah.
give a little personal story about this before I go anywhere else. My husband had a seizure uh, a year and some back, and he's a healthy man with no medical history, and suddenly landed up having this big grand mal seizure, and no blood work, no neurology, nothing showed any reason why this could be happening. It put me into the rabbit hole trying to figure out for him what's going on. I had seen him snore, and I knew that there is a likelihood, being an airway trained dentist, but we had not done a sleep study because I couldn't convince him. When we finally did the study, he was not breathing 24 times an hour, and his oxygen was
Wow.
dropping to 73. So if I
Wow.
logically think about it, that the reason I'm telling this story is because when I shared this information with his primary care and with other folks, they're like, okay, yeah, that makes sense. But in his case, I saw the oral signs of the likelihood of sleep apnea before, but as a wife, I couldn't convince him, so we didn't proceed. But as a dentist, I saw the changes in oral signs. Now, why I think, and why his primary care and his other doctors agree with this diagnosis is because as the oxygen is depleting through the night, it's definitely affecting the brain activity, and when it becomes chronically
Correct.
affected, it may have manifested into an episode of seizure. I don't know. This is my layman explanation. But now let's dive into the mouth. In a typical visit, when my patient sees me for the first time, we are doing oral assessment, a very deep dive into the oral assessment, tooth by tooth, and the full mouth. But even before I get into the room with the patient, we are doing a saliva test, which is just taking a little sample from a tooth, putting it on the slide, and looking at all the activity. We are looking for those fast moving spirochete bacteria, that is called. We are then taking a scan of the mouth. That's just a photographic scan that shows me the size of the mouth, the positioning of the teeth, and the wear and tear, the restorative work, the failure of the work, things like that. And then I finally go in myself after the x-rays are done and I chat with the patient. Why I take this information is because this gives me an insight into the patient's dental health, but more importantly, the airway health. The airway health is associated to all of those things. If your tongue is not having enough space to sit in the mouth, as we lay back to sleep, the tongue is going to fall into the throat, block off your
Yep.
oral pharyngeal path, and you will be breathing from your mouth, and therefore less oxygenation is happening. This leads to more dryness of the mouth. Then finally, as patients are clenching and grinding, that is a reaction of your body trying to wake you up to breathe, because when people stop breathing, so we will see the wear and the breakdown. Sometimes we see severe fractures of the teeth. I recently saw a patient who had severe sleep apnea, had broken down most of the teeth, and her tongue was grazing against those broken down teeth, developed a
Oh.
traumatic ulcer. Ultimately, the ulcer turned into squamous cell carcinoma. Then the tongue
Wow.
was the part of the tongue was removed, and it was grafted with her from a skin from her wrist. It was placed on it. It's a life-changing event if that happens. And if the simple answer was knowing the patient's breathing, sleeping pattern and protecting the patient's mouth and her airway, we could have prevented all this from happening. And she was one of the lucky ones who got saved by that. There might be so many who don't wake up because they are not having
Absolutely.
enough, brain strength. I recently So the reason I'm giving you all this is because I'm trying to explain why we do this. I'm looking into the mouth. I am making that assessment, and I'm having conversations about the size of the mouth, the shape of the mouth. If it's a V shape versus if it's a horseshoe, like a nice, a big broad mouth. Each of these depends, because your tongue in its rest position is supposed to sit on the palate right behind our upper front teeth. If the patient does not have enough room, if the arch is very narrow, the tongue does not find that room to sit in. And that's why it will get thrown into the throat. The scallops on the tongue are telling me that the size of the tongue and the size of the mouth, there is a disparity. There's a very famous airway doctor. His name is Felix Lau, and he says, he has a book says 3 foot, 6 foot tiger in a 3 foot cage, because the tongue is that 6 foot tiger is trapped in the 3 foot cage, and that's why all these problems start. So, of course, I'm only talking about obstructive sleep apnea that is associated with the anatomy, and how the anatomy can be helped by somebody like myself as a dentist if a patient is not thinking of a CPAP, because CPAP is fairly restrictive, and some patients would have, I would feel claustrophobic and things like that. They want a simpler option. So I make for them what is called a mandibular advancement device. And this is just a simple top and bottom device that repositions the lower jaw slightly forward, and it creates more room in the mouth. The patient sleeps without having to open his mouth up and breathing more comfortably through the nose. So now, again, personal experience, I have made this for my husband, and I hear him sleep very, very comfortably through the night without snoring. So am I a happy spouse? Yes, but I'm also feeling comfortable that he's safe. So
Yeah.
because now he's having more nasal breathing. So those are the reasons why I take sleep apnea very seriously, and I guide most of my patients to have a sleep study. Sleep study allows them to know their numbers. I don't like to throw a mouth guard at anybody as just because you're grinding, because that is a very old school, very like, blinders on your treatment plan process. You're not even asking the question, why are you grinding? I tell the patient very honestly, there are very, very, very little chance that this is just a dental grinding. There is no such thing as a dental grinding. So
Wow.
if you are grinding, we need to know why. And if there is a likelihood of you having a diagnosis of sleep apnea, then we need to first address that. So oftentimes, the big discussion is giving the patient enough space in their mouth by making the arch bigger. That should always be my first goal, because that allows for both the teeth to live happily in the mouth, the tongue is more comfortable, and it may organically help the patient sleep. But even after that, if there is the possibility, then I always make the patient an appliance, or I have them get a CPAP, whatever they may need. But I'm just saying, for an ideal situation, I always want the arch to be bigger so that they can have comfort in the mouth and easy to floss, easy to clean, things like that. So, and the dentistry survives. The teeth are not falling apart just because of the excessive loading forces on them. Sorry, I get very
Yeah.
passionate about this. I talk too much then.
No, thank you. I'm really enjoying the connections between the tongue, the teeth, the arch. I was testing my tongue in my mouth to see which shape I have, if I have enough room there. So this was really fascinating, and thank you for sharing your personal story throughout this too. It
Uh-huh.
just, sent home the message, that how passionate you are about sleep apnea. And 70% of strokes actually have
Mm-hmm.
undiagnosed mild, not even moderate or
Mm-hmm.
severe, but mild sleep apnea. So I can
Correct.
definitely see, the correlation, if you are chronically oxygen deprived, to that part of the brain, sort of setting the stage
Mhm.
for a seizure. And that's not even it. A lot of people unfortunately pass away in their sleep from
Mhm.
sleep apnea because it's not diagnosed or treated.
Correct.
And a lot of people, especially some women, think you have to snore in order to be diagnosed with sleep apnea. But
Correct.
from what you are saying, that is not even true all the
Mhm.
time. You can't be a non-snorer with undiagnosed sleep apnea. So
Right.
definitely see an airway specialist, or keep up with your dentistry appointments. Um, I
Not every
is
dentist, though, does
I
airway work. So I like to
Yeah.
say that because sometimes patients do get misguided in saying, I was told I don't have a problem. But I like to say it's always how deep your provider is diving into the nature of the problem.
And I love how you don't just say, teeth grinding is just happening, and you take that step forward of asking, why is this happening? We need to,
Hmm.
dive deep into why you are grinding your teeth, because that's a sign of discomfort. And
Correct.
would you believe it that probably this grinding of teeth and this tension that people go through during the night, then often we see an elevated cortisol in the
Hmm.
morning.
Correct.
So that's how I refer the patient for sleep apnea testing, is because her
Hmm.
cortisol in the morning was so high. And I said, you
Correct.
might be having a stressful event when you sleep. And the
Hmm.
only thing I could think of was sleep apnea. And lo and
Correct.
behold, she has moderate sleep apnea, and now she's
Hmm.
wearing a CPAP. And lo and behold, her insomnia is gone and her daytime fatigue
Yeah,
is gone.
that's beautiful.
It's
You know, the
magical.
statistics is
It's magical.
7 in 10 people have sleep apnea, and 5 of those 7 are undiagnosed. That's why
Hmm.
when I am, and I'm not saying this out of arrogance or whatever, but my diagnostic ability for seeing my patients' oral manifestations and telling them that please have a study done because you may be at the risk of sleep apnea. Because as a dentist, I can't prescribe a study. So since January, I've been looking at our data. I have sent probably about 100 patients for sleep study, like requested
Wow.
their sleep study by their sleep doctors, and not one single one of them came back without a diagnosis. So I
Wow.
am quite taken aback by how much sleep apnea truly exists.
That's astounding. That is
Yeah.
astounding, because nobody talks. This is not something we ask patients, like, are you sleeping well?
Hmm.
Why do you have insomnia?
Correct.
And usually we see it very late. A lot of diagnoses are happening when it's severe.
Hmm.
I could go on and on. This is so fascinating. You make the mouth such a fascinating place. I'm just,
Yeah.
I really love it. It's just so nice to see how you connect these dots again. So, as we are wrapping up, are there any things that you want the audience to know that you haven't shared yet?
I mean,
We
how
talked
many more
about
hours?
oil pulling, we talked about mouthwash, we talked about microbiome, we talked about hormones, and then the big one has been sleep apnea.
Correct.
So is there a routine that you do? What would you like us to know? What can we do starting tomorrow morning?
I mean, I say very, very simply, if try to look into your product, what you're using, try to make sure it's not loaded in chemicals, do a careful evaluation, what kind of I'm not a product pusher, so I say it with caution. Read the label carefully. Don't look at things just because it's advertised well or it shows up on our, different social media platforms. Look at it from the perspective of how clean is that product. And that's how I choose most of it. When I go to a conference, I come back with a few samples, and then I try to figure out what has the least amount of stuff added to it, and that's how I go for it. So that would be my biggest takeaway. My personal regimen is I'm obsessed with my teeth, and I brush and floss after every meal. And I'm not saying after 30 minutes of the meal. So let me say that with caution, because this will cause a debate otherwise. So after 30 minutes of eating, I do brush and floss my teeth. I I brush and floss at night. After that, I do oil pulling. I do mouth tape. I wear my retainers because I had aligned my teeth many years back. I wear my retainers at night. I have done a sleep study on myself. I did not have a diagnosis, but because I could be at the risk, I have a smaller mouth. Doesn't look like, but I do. So I tape my mouth up, and I put my eye mask on, and that's how I sleep, because I want to. Uh, I see the value in good sleep in the restorative part of it. So therefore, these are the little measures I take for myself uh,
Thank
from an oral
you. Thank
hygiene
you.
perspective.
Yeah, thank you so much for sharing. I told you this, Dr. Gupta is world renowned. People come out of state to see her because of her special set of skills as a biological,
Um,
holistic dentist. She goes internationally to learn to improve her skills every day, to stay up to date with what's going on around the world. So I know her her way of treatment is very forward thinking and very progressive, and that's what I love about Dr. Gupta, and that's why I invited her here. So can you tell us where the listeners can find you? I know you have a very active Instagram page, and you do a lot of fun things there. Can you tell the listeners where they can find you um,
uh,
on
so I
online? And yeah,
okay. So I'm practicing in Rochester, New York, and my office is called BG Dental Wellness and Cosmetic Center. And I do have a social media page on Instagram, which is at BG Dental Wellness. And our website is also bgdentalwellness.com. So we do try to keep up with a lot of new stuff that I bring into the office, and that gets put onto the social media as well as the blogs. I forgot to mention, Dr. Ruth, I have introduced a new equipment in the office, which is uh, trying to create anesthesia without having to inject a patient. So, pain-free
wow,
dentistry without the anesthesia. So there is a new technique we brought in, and
wow.
I since it just came in about 2 weeks back, I'm slowly becoming a believer, but I'm already seeing a difference. So it's pretty cool.
Can those of us who have severe phobia with just cleaning, is that an option for those
Absolutely.
patients? Okay,
So
I
my
love that.
our hygienist uses it on all her patients. She numbs. It's not numbing. It's like just an electrical stimulation that's given, which causes a pain-free feeling. And she's been doing all her hygiene with that. So it's very, very nice.
Again, very progressive, very ahead of her time. And I really appreciate all that you do here in Rochester and abroad. So thank you so much for coming.
Thank you.
Follow her on Instagram. She's always dropping gems and sharing her broad and extensive knowledge regarding biologic and holistic dentistry. also cosmetic, but mostly looking at it from a very root-based analysis. So I appreciate that. Thank you so much for coming,
Thank
and we
you.
would love to have you again once you, anytime in the future, you are welcome back here. Thank you.
Thank you.
Uh, Bye.